name is Drew Young, and today I will explain how to confirm placement of a double-lumen tube. A double-lumen tube isolates and ventilates a single lung. There are right and left-sided tubes with two lumens, bronchial, placed in the right or left mainstem bronchus, and tracheal. The bronchial lumen and the tracheal lumen correspond to the bronchial cuff and tracheal cuff, respectively. The air injection ports inflate the cuffs. The right angle connectors have caps for venting, suctioning, and scoping, and the Y connector attaches to the breathing circuit and ventilator. The proper location for the placement of a left-sided DLT is shown here, with the bronchial cuff in the left mainstem bronchus and the tracheal lumen at the carina. There are two ways to confirm proper placement using either a flexible bronchoscope or auscultating with a stethoscope. Using a bronchoscope through the tracheal lumen in a left-sided tube, you first see the bifurcation of the carina with the bronchial tube down the left mainstem and the bronchial cuff just barely poking out. You can confirm proper placement by seeing the trifurcation of the right upper lobe. If you pass the scope through the bronchial lumen, you see the bifurcation of the left lung lobes. Using a stethoscope, the principle is simple: clamping and auscultating for breath sounds. In a left-sided tube, if you clamp the tracheal lumen, you should hear no breath sounds on the right and breath sounds on the left. If you clamp the bronchial lumen, you should hear no breath sounds on the left and breath sounds on the right. The same test can be applied to a right-sided tube. If you hear the opposite of what you expect, you may have placed the tube in the right instead of the left. If you are too far in the left main stem with both lumens, when you clamp the tracheal lumen, you may still hear breath sounds on the left through the bronchial lumen and no breath sounds on the right. When you clamp the bronchial lumen, you may hear faint or no breath sounds on the left depending on whether your bronchial cuff fully obstructs the tracheal lumen, and no breath sounds on the right. A similar pattern of breath sounds can be heard if both lumens are too far down the right main stem, though the pattern of breath sounds would be mirrored. If you are too far out and both lumens are above the carina, when you clamp the tracheal lumen, you will hear breath sounds bilaterally through the bronchial lumen. And when you clamp the bronchial lumen, you will similarly hear breath sounds bilaterally, assuming the bronchial cuff does not fully obstruct the tracheal lumen. Thank you very much for listening to this discussion.